say it is.
Now News Extra here on KNEB, and with our program here again, Kevin Mooney.
Thank you very much, Dennis. Good morning, everyone. We're going to talk about a subject that many people have tried, and maybe successfully, maybe not successfully, and maybe both of those. Smoking cessation. Regional West Physician Clinic launching a new smoking cessation program. And we have Brooke Borgman here. She's a nurse practitioner with the Regional West Physician Clinic. She's head of that program. How you doing?
Good, how are you?
I'm good. All right, so you guys started this program here just very recently, right?
Yes, about 3 weeks ago.
All right. And the hospital had done this before. What's the reason why you guys decided, okay, maybe it's time to bring it back?
Normally I work in pulmonology. We're seeing a lot of patients that their lives are altered forever because of smoking. There's also not a program in the community with smoking cessation, and it's affecting a lot of people's lives, so it's something we can do to help the community.
All right. So this program can be paid for by private insurance, Medicaid, Medicare, all those things, covered by all.
Absolutely.
Right? Okay. Initially, it involves an initial consultation, and you were saying before we came on, that's what, about 45 minutes?
Yeah, the initial visit is 45 minutes, and then depending upon insurance is how closely we can follow up with you, but the subsequent visits are not as long.
And depending on what you have for insurance, or Medicaid or Medicare, you get so many visits.
Absolutely.
So, for example, Medicaid, you only get 4, is that right?
Yeah, Medicaid is 4 visits twice a year, and Medicare is 8 visits twice a year.
And then private insurance, it just varies?
It just varies, yes.
So when they go on these visits, in the first one, you're counseling them, you find out what the triggers are, some of those other things, right?
Yeah, we're talking about what their triggers are, their past quit attempts, what they've done, maybe where they succeeded, where they failed. Also what they can do in the future to help them be more successful.
And what kind of things can you do?
There's nicotine replacement therapy. There is multiple different apps on your smartphones that you can use. There's medication that we can prescribe to help you with that. Also looking at your triggers so you know where you maybe have failed in the past or to prevent you from failing in the future.
So what are some of the bigger triggers for people that cause them to, if they've quit, to start smoking again, or if they're smoking like for the most of their life, what are the triggers that cause them to do it?
Some people it's stress, some people it's after a meal. Getting up in the morning, having a cup of coffee, that's a trigger for a lot of people. A certain time of day, if it's break time, they want to go out and smoke because they've done something.
Yeah.
Also getting in your car to drive is a big trigger.
Yeah, you mentioned the one woman that said, I can't start my car without a cigarette.
Yes, yeah, and that's just how
that's
how
weird.
addictive
It's
it
just
is.
one thing that she's doing, and she's always done it that way, and that's the way it is, right?
Yes, absolutely.
Yeah, okay.
Another trigger is just having the paraphernalia, the ashtrays or lighters or the cigarettes laying around and being able to see that. Those are huge triggers for people.
So if you can get rid of that, the
Yes.
ashtrays and all that stuff.
Yeah, that helps.
Yeah, now I'm sure that's difficult for people to actually, when they say, okay, I'm going to quit, to actually throw those things away, or, I mean, if you just put them in a room where you know they're going to be, you can go in there and get them again, right?
Yeah, absolutely. Average people try to quit 3 or 4 times, and so throwing that away is expensive, and so people kind of want to try to hold on to that because what if I fail?
Yeah.
And so then it's very easily accessible, and so it's easier to quit or start again smoking.
All right. We'll talk more about this right after this break.
When smart businesses need to grow their team, they do it on the site proven to deliver. Indeed.com. According to an independent study, Indeed delivers 5 times more hires.
Switch places with you. I need to go in here.
And again, some of the
Right now, we're
medications.
giving new users a $50 credit to post a sponsored job, boosting your listing in relevant search results. Claim your $50 credit at Indeed.com/credit. Indeed, the world's #1 job site. Terms, conditions, and quality standards apply.
Partner Coalition.
We're back on News Extra. We're talking to nurse practitioner Brooke Borgman. She is heading up the new Smoking Cessation Program over at Regional West Physicians Clinic. They just started this about 3 weeks ago, and it's a program where you get counseling, you get help with the Nebraska Quit Line, Brooke, right?
Yes, Absolutely.
That, and now the Nebraska Quit Line, what does that do?
It's people who are ex-smokers, but it's they're also smoking cessation counselors. It's available 24 hours a day, and it's free for anybody to call into them. Majority of states do have them, so and if somebody's in Wyoming, they have one as well. And they are able to talk you through if you have a problem. You know, it's the middle of the night and you can't call up to the clinic because I'm not there. That's an option that you can call in, and they give you assistance with that.
All right. So a lot of people probably use different things to quit smoking. Like
Mm-hmm.
my wife used sunflower seeds to quit smoking
Mm-hmm.
long time ago, first part of our marriage. And I don't know, my father, I don't know whether he off and on,
Mm-hmm.
but you had some folks from Rutgers come in. Talk about that.
Yeah, they just they were here last week talking to us about smoking cessation and different things, you know, that people can do and the struggles with it. It was a wonderful resource to have in the community.
That's good. That's very good. And some of the things people can use to smoke, you give them, there's medication, right?
Yes, there's two big different two medications out there that are the bigger ones that people use is the Chantix and Wellbutrin. Wellbutrin's been around for a lot longer than the Chantix have. But those are the two most effective in helping people quit smoking.
Okay. Do you work on chewing tobacco as well here?
Absolutely. Anything that that's tobacco related. we
All
work
right.
with.
And nicotine, of course, very addictive. Gets to the
Yes.
brain real fast, and
Yes.
there you go.
Yes. Studies show that nicotine reaches the brain in 11 seconds after a puff on a cigarette, and there's nothing more addictive than that. Not cocaine, methamphetamine, cocaine, crack cocaine, anything.
All right. Okay, what's the number real quick to call? We only got about 15 seconds here.
630-2101.
630-2101. Right?
Yes.
Okay, very good. Thanks for stopping in. We appreciate it.
Thanks for having me.
You bet.
KNEB, Scottsbluff,